Ladies and gentlemen, physicians play a crucial role in the lives of patients, one that is irreplaceable. They strive for and deliver high-quality health care each and every day in this province. And our government has regularly worked together with the Ontario Medical Association on many crucial issues over the years. A few years ago, together, we developed a process for how we would negotiate a new agreement. And that was the process that we followed through to the end. Unfortunately, the OMA rejected the offer produced by that process and decided to walk away from negotiations. Since that time, I've repeatedly urged the OMA to return to the table to continue negotiations and to work with us to improve our healthcare system in a sustainable way. But I need to set the record straight about a few things they've said. Let's start with the level of compensation that Ontario doctors receive. According to the Canadian Institute of Health Information, Ontario physicians bill $368,000 on average per year. Many specialists can make 2 or 3 times that, or even more. And over the past decade, we've increased the amount the average doctor in Ontario earns by more than 50%. Ontario doctors are, according to the Canadian Institute for Health Information, the best paid in Canada. And for that, we make no apology. They should be the best paid because they are the best. They provide excellent care for their patients. And that's why we are increasing the budget for physician compensation, which is currently over $11 billion this year, about a quarter of what we spend on healthcare in this province, and nearly 10 cents out of every single dollar this government spends. This year alone, we increased that physician services budget by approximately $140 million. A jurisdiction that pays its doctors well, or in our case, pays them better than anywhere else in the country, is a jurisdiction that will continue to attract the best, keep the best, and help provide patients with outstanding access and care. So I think paying our doctors well is important public policy, and I will fight for that to remain the case. But let's focus for a moment on 2 claims the OMA routinely makes. First, they suggest that when we talk about physician compensation in this province, we forget to mention that doctors have overhead costs for their offices and their staff. The implication is that take-home is far lower than we'd have you believe. Well, let's explore that for a moment. Yes, it is true that many doctors have costs associated with their practices. Not all, of course, since many work in hospital settings and have those costs paid for by the hospital. But it is also true that they receive a great deal of help with a lot of these costs. Help that many people in other kinds of business do not enjoy. For example, enormous investments have been made to help physicians with the costs of medical software, online diagnostic tools, and electronic medical records. Even hardware like computers is sometimes subsidized. Liability insurance, a cost that doctors in many other jurisdictions bear personally. We significantly subsidize this cost in Ontario, paying 80% of liability insurance costs. Doctors are also able to incorporate, write off costs like other small businesses do, pay lower taxes, defer taxes, and split income with family members. They are able to charge their patients tens of thousands of dollars in block fees for refilling medication, filling out forms, and taking phone calls. Again, I'm very proud of the support that we provide our doctors, so I make no apologies for it. But it's important that we have an honest conversation about the facts. A second argument we often hear from the OMA is that our increases to the budget for physicians' compensation failed to take into consideration the costs of an aging population and the addition of new doctors. But that's simply not true. The reality is that we turned to an independent third party to advise both the government and the OMA on the proper budgetary increases. This independent arbitrator, former Chief Justice Warren Winkler, considered growth factors like new doctors and the needs of seniors. He provided us with recommendations, and the OMA has rejected them outright. As I like to say, we took this issue to an umpire, and the umpire ruled in the government's favor. Yet the OMA refused to accept the umpire's call. The OMA has no answer for this fact. So they simply pretend this arbitrator and the government are ignoring factors that we all know have indeed been considered and included. Finally, we increasingly hear the OMA try to scare patients by saying that doctors are leaving Ontario. And this is the one that I take greatest issue with. This claim isn't just wrong, it flies in the face of evidence. In fact, since 2003, we continue to see annual net increases in the number of physicians in Ontario. The data for the most recent year available, 2014-2015, shows that we saw more than 950 new physicians start practicing here in Ontario. That's 950 net new physicians, even after taking into account retirements. And we are projecting a further 13% increase in the number of physicians practicing in Ontario between 2015 and 2020, roughly 3 times the population growth. The OMA is right about one thing, though. They are right to say that something's wrong with the way our doctors are paid in Ontario. Last year, one doctor here in Ontario billed the government over $6.6 million. That's a staggering number. And what it says to me is that we need a new collective approach to how physicians are compensated. It's an issue that I've struggled with since taking on this portfolio. The truth is that the budget we set to pay our doctors year in and year out is never truly set. It isn't even predictable. Right now, because most doctors in this province bill for every service they provide, they effectively set their own salaries. That means no matter what we budget or what budget figure we've projected, the healthcare system has to find the extra, knowing that it means less for access, less for home care, less for palliative care, and less for other services that patients depend on. And the OMA is determined to keep it that way. Even though we're increasing the amount of money we set aside for physician compensation each year, an additional $140 million this year alone, the OMA's position is that there should be no limits on spending. And that creates problems, as I just mentioned, when it comes to ensuring that we have enough to invest in other areas of our healthcare system. According to new data, in 2014-2015, the number of doctors billing Ontario taxpayers more than $1 million a year jumped yet again, and now stands at more than 500. And let me be very clear. This isn't about hardworking family doctors or pediatricians. In fact, the vast majority of the 500 physicians on this list are not the family physicians that are providing patients with day-to-day care, nor are they physicians working in high-pressure situations, practicing emergency medicine or neurosurgery, for example. In fact, the 2 largest specialties that account for nearly half of all high billers are diagnostic radiologists and ophthalmologists. Of the top 5 billers in this province, 2 are ophthalmologists and 2 are radiologists. The 5th is an anesthesiologist. Now, I'm not saying that these doctors did anything wrong. What I am saying is that there's an inequity in the fee code structure that has created this unfairness in the system, one that is particularly unfair to family doctors and others at the average or even below the average level of compensation. And a system that permits this is a system that has grown badly out of balance. It needs to be addressed. It's also important to remember that while these 500 plus doctors represent only 2% of the physicians in Ontario, they account for almost 10% of the physician service budget. Now, we have tried repeatedly to address this issue with the OMA for many years, but they have yet to take this seriously. While they say they want to be leaders in managing the healthcare system, they are not taking the responsibility to ensure that all doctors are being treated fairly and that our system is sustainable and equitable. And as I've already said, we have a budget for physician compensation of more than $11 billion. That includes more than 7,000 individual fee codes for doctors to bill the government. And over the course of more than 2 years, and approximately 80 separate proposals that we've taken to the OMA has been unable to identify even a single fee code out of more than 7,000 that needs to be adjusted, that needs to be lowered, that is too high. They've rejected every single proposal that we've presented to them. So, ladies and gentlemen, we need the OMA to work with us on a fair and predictable budget for physician compensation. And here's why. For 2015-2016, we increased our overall budget to pay doctors to $11.6 billion. We're increasing it again this year by another $140 million. But the total billings from Ontario's physicians are still projected to significantly exceed that amount. And that money, unbudgeted, has to come from somewhere. There is a societal opportunity cost. Would you be surprised to learn, in fact, that every year billings have been more than the budgeted amount? That over the past 4 years alone, the billings over budget in the physician services line is close to $750 million. $750 million. That's $750 million in unbudgeted compensation for doctors that the OMA just expects our healthcare system to pick up from somewhere. $750 million that doesn't go to fund new home care initiatives or hospital budgets or other frontline healthcare workers or other health needs for patients. That's $750 million that could have been provided for almost 60,000 chemotherapy treatments, or 2,900 registered nurses in our hospitals, more than 5 million hours of in-home personal support service for Ontarians, or approximately 2 million nursing visits. It's necessary to recalibrate things, to at least enable some measure of fairness and evidence to the system. Technological leaps in radiology and ophthalmology, for example, where many of these high billers practice, has reduced the physician time required per case. That's a good thing. But if productivity is going to increase so rapidly, we must also reflect that in the fees those specialists can charge. So I come back to it. The problem we face is not simply how much we pay our doctors, but how we go about it. We need a rational, evidence-based budget with predictable increases. One that we can plan around. One that doesn't jam us year in and year out with hundreds of millions of dollars in excess fees. Fees that reduce our flexibility to invest more in other priorities like home care and seniors care. I'm not just the Minister of Health. I am a physician. I understand how this profession works. I understand how important this profession is to our province and to our patients. But I also understand that as minister, I hold the responsibility for managing the entire healthcare system. And I understand that something has to change. Our doctors must remain well paid, right at the very top of those in Canada. I will not permit that to change. They deserve it, and so do their patients. But the way we pay our doctors, the unpredictability it creates, the irrationality it imposes, and the way it can reward volume over value, that must change. And I want to change it with the OMA. We want them at the table, working with us to improve the system for patients and for physicians. Unpredictable and frankly uncontrolled billing by some doctors is a problem that creates huge income for some doctors, leaves less for family doctors and others, squeezes our ability to invest more in home care and community care, and robs us of the capacity to responsibly plan our health care spending each year. It must be fixed. We need to ensure that fees are structured so that they promote better care and better outcomes for patients, and to ensure that all physicians are paid fairly for the important work they do and the care that they provide. We want the OMA to be working with us on how to ensure we pay our doctors well, while still leaving room for us to continue investing new dollars in patient priorities like home and community care. Now, for some time now, I have been asking the OMA to come back to the table and negotiate a deal that addresses this important issue of fairness and sustainability. Unfortunately, the only public response we've received is another attack ad from the OMA. Frankly, it's disappointing. These attacks don't help patients. They don't help doctors, and they don't help the people of Ontario. What patients and doctors need is for the OMA to come back to the table and work with us on a fair, evidence-based, and predictable physician services budget, so we can continue to make the necessary investments in hospitals, in community care, in mental health programs, and in doctors. But right now, there's only one chair at the negotiation table, and it's us. So once again, here today, I'm urging the OMA to come back to the table. And even though other provinces, such as Nova Scotia and British Columbia, are moving away from arbitration from doctors, for doctors, and despite the fact that only 20% of Canadian doctors have any form of arbitration, I am prepared to discuss arbitration as part of formal negotiations on a fair, evidence-based, and predictable budget, as well as the important and pressing issues that I've raised today. And ladies and gentlemen, this has been my position for many, many months. We have an opportunity to move forward in a way that will serve both doctors and patients a whole lot better. I hope this is an opportunity that they will accept. It's what their members deserve, and it's what patients deserve. Thank you.
Can you tell me what